I'm Mark Anthony Estructor. I'm P.J. Gonzalez.
I'm Riley Dillasca. I'm Eros Milabalanes.
I'm Christian Sinuin.
And we are Team 3.
Philippine Health System. It talks about the healthcare in the Philippines. Philippine Health System. In its current decentralized setting, the Philippine Health System has the Department of Health serving as the governing agency and both local government units and the private sector providing services to communities and individuals. The DOH is mandated to provide national policy direction and develop national plans, technical standards, and guidelines on health. Under the Local Government Code of 1991, LGUs were granted autonomy and responsibility for their own health services, but were to receive guidance from the DOH through the Centers for Health Development. Provincial governments are mandated by providing primary care, including maternal and child care, nutrition services, and direct service functions. Rural health units were created for every municipality in the country in the 1950s to improve access to the health care. The PhilHealth introduced health technology assessment in the early 2000s to examine current health interventions and find evidence to guide policy, utilization, and reimbursement. As a third-party payer, PhilHealth regulates through the accreditation of health providers that are in compliance with its quality guidelines, standards, and procedures. Healthcare in the Philippines varies from high-class to non-existent. Most of the national burden of healthcare is taken up by the private health providers. The private sector, which is much larger than the public sector in terms of financial, human, and technological resources that cater to 30% of the population. Although the private health sector is regulated by the DOH and the Philippine Health Insurance Corporation, health information generated by private providers is generally absent in the information system of the DOH. PhilHealth provides a means for the healthy to pay for the care of the sick and for those who can afford medical care to subsidize who cannot. Both local and national government allocate funds to subsidize the indigent. At present, patients' rights and safety are expressed under the purview of the Penal Code and Medical Acts of 1951 and 1959 and Health Professional Practice Acts. The lack of a gatekeeping mechanism in the health system allows patients to choose their physicians. So, health financing flow in the Philippines. The health financing system in the country as it involves different layers of financial sources, regulatory bodies, and health service providers. These figures shows the financing flow for health as to sources and uses. In general, there are four main sources of financing: national and local government. Second is the insurance for government and private. And number 3, user fees. And for number 4, donors.
Number 11. Philippines experienced dramatic improvements in level of child and maternal mortality and communicable disease control during the second half of the 20th century. However, gains have slowed in recent years, in part due to poor health status of those on low income and living in less developed regions of the country. Life expectancy in richer provinces is more than 10 years longer than in poorer ones. Summarize the organization and governance of the health system, including the underpinning governance and regulations. Describes the financing of the health sector in the Philippines. It includes an overview of system, levels of spending, sources of financing, and payment of mechanism. Describes the health services delivery mechanism, explaining the various facilities available at each level, and the referral system. A study carried out by PhilHealth in 2006 among its sponsored members found that The major reasons for non-use health centers were lack of health information and inadequate service provision. Approximately 30% did not know what healthcare services were available. Another 41% did not know that PhilHealth membership was accepted in health centers, and 29% of responders were unable to access the service they needed. Sick members not using PhilHealth card for the health center service. The status of information received by sponsored members is reflection of the information gap in the outpatient benefit package. Just over the half of 54% of surveyed respondents were given information on the availability of the outpatient benefit in the health center, while 46% were provided information on what benefits are included by PhilHealth. Only 57% of sponsored members were informed about their reproductive health benefits. 44% were told that services are included in the package, and 39% what lab. The services they could receive from the health center. In contrast, more than 90% of the respondents know that they could use their PhilHealth membership of hospitalization.
The total health expenditure increased from 87 billion in 1995 to almost 225 billion in 2007. National Statistic Coordination Board 2007. Although there is an increase in the total health expenditure in nominal terms, its share on the GDP is still at 3.5 to 3.6%. This picture shows the share of different financial resources of the packet as the largest share of the total health expenditure. Despite the safety net and HIV, the share out of the packet expenditure increased from the 42% in 1997 to 57% in 2007. The share of local and national government subsidy also decreased on the same period.
This graph shows that the private hospitals outnumbered the government hospitals in all categories. The disparity is more noticeable in the tertiary hospitals, where the number of private hospitals is 4 times that of the government hospitals.
The number of hospital beds is also a good indicator of health service availability. For whole recommendation, there should be 20 hospital beds per 10,000 population. The table describes the distribution of private and public hospital beds by region. Almost all regions have insufficient beds relative to the population, NCR, Northern Mindanao, Southern Mindanao, and FAR. Among the 17 regions, ARMM has the lowest bed to population ratio for all national average.
The current state of health information systems closely reflects the larger health system. The national and local health information system are poorly integrated and weakly governed by the PHIC, has the largest clinical database in the country and has one of the most sophisticated information technology infrastructures. Yet, it still manages claims actually using paper. This adds a due burden on both providers and payers and increases the cost of processing claims on hospital and on PhilHealth. The incomplete implementation also prevents the corporation from realizing the economic benefits from computerization. In terms of information use, the lack of timely, accurate data from claim limits PhilHealth's ability to detect fraud and monitor disease patterns.